I chose medicine as my career really goes back to when I was a junior and senior in college. I had a very close relationship with my grandmother growing up, and her health started to decline during that time. I was able to be with her through, many of her tests and hospitalizations and so forth. And when I was, observing all of this, it was very clear to me that not only were her clinical team able to really provide her with the best quality of life for the last years she had here with us, but the relationships that she developed with her clinical team, her physicians, was really amazing to me. And I think that was the first time that I really was able to witness, that connection between physician and patient, and not just for medical care, but really just a true relationship, a true connection. The most rewarding part about being a doctor for me is being in the rehabilitation medicine world, being able to take care of patients at times in their lives when they've gone through typically pretty catastrophic events, and being able to work with a team of clinicians on a daily basis who are caring and compassionate, and being able to provide not only medical care for patients, but also establishing very strong, deep connections with patients and their families as we care for them while they're hospitalized, but also after they're discharged for many years to come in our lifetime clinic, follow-up clinic. A question that I always hope that my patients are comfortable asking me is about connection that I may have with them based on the fact that I've been living with a chronic disability for quite some years, and I take care of patients with chronic disabilities. So I'm always hoping that they're comfortable enough to ask me questions that may not be medically related, but may be something they're going through related to their disability that I may be able to connect with them on and help them, walk through that issue, or help them problem solve an issue that, again, might not be directly medically related, but might be really critical in their daily life. Something my patients may not know about me is that I'm an avid sports fan. I played many sports growing up, and as a young girl, grade school, high school, and even in college. And now, just an avid fan of all sports. I am a true Phillies fan. I would say that probably two of my favorite memories are sitting on Broad Street, Broad and Fitzwater, waiting for the Phillies to come down Broad Street during the parade, and the same with the Eagles when they won the Super Bowl. I'm Dr. Jeanne Doherty. My mission at Jefferson is to improve lives.